Come on in.
Hi, good morning.
Good morning.
This is me washing my hands. My name is Natalie.
Hey, Natalie.
What's your name?
Alex.
Perfect. Please excuse me, I'm doing the best I can. I have pharyngitis at the moment. If you have any questions about my assessment or what I'm saying, please feel free to reach out and I can verify if you couldn't understand. Thank you. So what I'm going to be doing today is more of a head to toe thorough assessment of every body system. So I'll have you up and down and move a couple positions and ask you to do a few things and listen and look. Is that you okay with that?
Yes, ma'am.
Is there any cultural sensitivities I should be aware of?
No.
Okay. So right now with his neuro assessment, he's ANO times 4. I'm looking at his skin also. Cleanliness is noted. There's no body odor noted. Skin tone is appropriate for ethnicity. And there's no immediate lesions or wounds that I'm seeing. I'm going to look at your hair now, okay? Look down. Okay, and up. And then I'll look at your nails. Okay, so his hair, the color is dark brown. It's got an even pattern with one cowlick in the back. There's no bald spots noted. The pattern is consistent, and the same goes for his beard. No lesions or wounds were noted. As far as his nails go, the nails color is appropriate with the clear with the pink bedding, and it's got a nice curved shape to the cuticle, and he had positive capillary refill on all 10 digits within normal limits of less than 2 seconds. Okay, so now I'm going to look at your mouth. Got my light. Go ahead and say ah. Lighter. Okay, so his oral mucosa is pink and moist, as well as his gums. There's an even, smooth tongue, and his lips are moisturized and symmetrical. There was no lesions seen in the mouth. His teeth were white with no chipping noted. Now I'm going to move into the lymph nodes. Okay, I'm going to start with the pre-auriculars. You let me know if there's any pain or tenderness, okay?
Okay. No pain.
Post-auricular,
No pain.
occipital,
No pain.
tonsillars,
No pain.
submandibular,
No pain.
the submental at the midline,
No pain.
anterior cervical chain,
No pain.
and then the cervical chain deep,
No pain.
and then the supraclavicular.
No pain.
Okay, with this assessment, there was no inflammation. They felt the same on both sides. No pain or tenderness noted. Now I'm going to auscultate the carotid arteries one at a time with the bell of my stethoscope, and then the trachea and so on. I'm going to start with the left. Okay, look that way. Okay, so his carotid arteries sounded good. There was a nice swishing sound that was heard bilaterally. There was no deviation noted to his trachea. It was at the midline at the supraclavicular notch. It was also appropriate with swallowing. When I palpated his thyroid, it was present, no inflammation, no pain or tenderness or swelling noted. Now I'm going to move into the eyes and ears.
Mom, are you ready?
I can't. Let's close the door. Okay, chemistry. Okay, I'm gonna whisper a question in your ear and you tell me if you can hear it, okay?
I can hear you.
Okay, asked him what day it was and he said Sunday. Are you in any pain right now?
No.
I'm gonna look at your eyes with a pen light. Very good. Good. Go ahead and close your eyes. Try to open them. Very good. I want you to look the 6 different gazes. I want you to look to the right, up high, like up to the right. Very good. Right, right down. Okay, left up, left, and left down. Okay, close your eyes and tell me if you feel something rub on your face, okay? Just tell me when you feel it.
I feel it. I feel it. Feel it.
Okay. All right, go ahead and smile big. Don't show me your teeth. All right, now show me your teeth. Raise your eyebrows. Squeeze your eyes shut. Squeeze, squeeze, squeeze. Puff your cheeks out. You can stop squeezing your eyes. Just puff your cheeks out. Stick out your tongue and say ah.
Ah.
Again.
Ah.
Go ahead and stick your tongue out. Go from side to side, up and down. Okay, try to go to the right. Good. Try to go to the left. Good. Okay, for the ears and eyes, he had a white sclera bilaterally. His pupils were round and reactive. His cranial nerve 8 is intact. By me asking him questions in a whispered voice, and he answered. He's currently alert and oriented times 4 with a 0 out of 10 pain score. Cranial nerve 3 is intact. By using the light, he had equal and reactive light accommodation. His pupils started about at a size 4 and went down to a 2 bilaterally. His eye and cheek muscles were both intact and appropriate within normal limits. His 6 fields of gazes were appropriate. There was no eye drooping, no shaking of the eyes. He had smooth muscle symmetrical eye movement. His cranial nerve number 5 was intact when you could feel the cotton wisp his face. His cranial nerve 7 was intact with his facial movements, and cranial nerve 9 and 10 was intact when he stuck out his tongue and said ah. With palpating and swallowing, the uvula was shaking at the midline, soft symmetrical palate, smooth voice, and then cranial nerve number 12 was intact when moving his tongue side to side. There was no trimming, no wasting. There was a forward thrush at the midline and bilateral equal resistance of the chin. I'm going to move on to the cardiovascular and peripheral vascular assessment. I'm going to auscultate for carotid brute specifically this time. Left side. Right side. Okay, go ahead and put your hands out. Just does that hurt at all?
Okay.
I'm gonna auscultate heart sounds now with my diaphragm. I'm gonna start with aortic. Good. Pulmonic. Herb's point. Tricuspid. And mitral. I'm going to go back through with my bell to check for S3 and S4 sounds. Okay. Okay, there was no carotid roots noted. There was no pitting edema noted on chest, arm, or legs. No swelling, no pain. Chest expansion is symmetrical. Colors within normal limit. No retractions when breathing, and respirations are unlabored and even at roughly 15-16 a minute. When I did the 5 areas for listening to the heart, everything sounded good and even with the diaphragm. I used the bell at the mid-clavicular line at the mitral valve at the 4th and 5th intercostal space. There was no S3 or S4 sounds noted. The heart rate sounded equal among all 5 landmarks. No murmurs noted. I'm just going to have you lay down real quick. Go ahead and put your left arm out. Alright, I'm going to the left axillary 5th intercostal space. And I'm palpating and percussing resonance, which means his left lower lung is filled with air, so that's good. I'm going to go ahead and assess your pulses while you're here, okay? Carotid left. Nice and strong. Carotid right. Nice and strong. Right radial. Good. Left radial. Good. Right popliteal. Good. Left popliteal. And then the dorsalis pedals. Right. And dorsalis pedals left. And posterior tibial. Present on the left, posterior tibial. Present on the right. Okay, you can sit up. All pulses were equal bilaterally. There was no big difference between the peripheral and central pulses. No bounding, no threading within normal limits, no concerns. I've already inspected the anterior chest. I'm going to inspect the back. No movement, skin color's normal, no lesions, no masses, no wounds, no retractions. Same for the front. Like I said, 15 to 16 respiratory rate. That was all symmetrical, no carpitis noted. I'm going to auscultate the front and back sounds using the diaphragm. I'm just going to tell you when to take breaths, okay? In, out, in, out, in, out, in, out. Okay, go ahead and scoot up a little for me. I'm going to do the 6 spots on the back. In, out, in, out, in, out, in, out, in, out, and that right lower lobe, in, out. Good. All regions sounded good. They were clear. There was no crackles, no wheezes, no stridor, and anything like that. Alright, you can go ahead and lay down for this one. We're almost done.
Thank you.
I'm inspecting the abdomen. So the abdomen is flat. Any pain or tenderness?
No.
Flat contour of the umbilicus is round and inverted. There's no lesions, masses, or scars or movement noted. I'm going to auscultate the abdomen's 4 quadrants with my diaphragm. Starting with the right lower quadrant. Low pitch gurgles. Right upper quadrant. Loud gurgle. Left upper quadrant. Good. Gurgle. Left lower. Good. They were appropriate. They weren't hypo. They weren't hyper. That I did not note any vascular sounds, which is good. So now I'm going to palpate, okay? Lightly palpate. Right lower. Pain or tender?
No pain.
Right upper.
No tenderness.
Push your liver. It's a good sign. Left upper.
No pain. No liver.
That's a spleen. Left lower.
No pain.
Alright, no rebound tenderness either. I'm gonna feel for an aortic pulse of an aneurysm. Let's hope nothing. Nope. No sign of an aortic pulse. So that's good. You can have a seat back up. So everything came back on his physical assessment on his head to toe. I have nothing abnormal to report to the provider, and I have nothing abnormal to upload into the patient's EMR. Thank you for your time today.
Thank you.
That was a lot of fun. And thank you.
Bye.